Hello. This FERNE video discusses the care of emergency department patients with dizziness and vertigo with the goal of successfully diagnosing and treating serious central etiologies. My name is Edward Sloan. I'm an emergency physician from Chicago, and I've served as the FERNE president and board chair for 3 decades. I have no financial conflict. Please go to our FERNE.org website and our YouTube channel for more content related to the optimal care of the patient with dizziness and vertigo. And follow us on social media for more real-time information on the care of all patients with neurological illnesses, injuries, and emergencies. FERNE.org. So this video session will address ATTEST Part 2, the Acute Vestibular Syndrome. It comes from the Timing and Triggers Approach to the Patient with Acute Dizziness, the monograph written by Dr. Jonathan Edlow for EB Medicine, published in 2019. As we look at the clinical pathway for the ATTEST approach to emergency department patients with dizziness, we come to the section where we consider whether or not the patient has acute vestibular syndrome. So if they don't have a clear general medical cause and they have continuous dizziness that is present at the time of the evaluation, they are considered to have acute vestibular syndrome. It could be caused by vestibular neuritis, a peripheral etiology, versus posterior circulation stroke. So this information is important. Distinguishing these two is an important part of what we need to do. So as you see the red star here, and in yellow, patients who have continuous dizziness that is present at the time of the evaluation, they are considered to have acute vestibular syndrome. So if they have no likely medical cause, or if they have some possible worrisome nystagmus, you then ask the question, do they have continuous and persistent vertigo? If the answer is yes, they have acute vestibular syndrome. That is either vestibular neuritis or labyrinthitis, which is peripheral, versus a posterior circulation stroke, which has stars by it because of its important significance and poor outcome relative to peripheral etiologies. So in considering acute vestibular syndrome, it is patients with constant, ongoing vertigo at the time of evaluation. These patients need to be addressed and evaluated clearly and quickly because of the potential for posterior stroke. If you have comments or questions about this FERNE video or any FERNE content, please get a hold of us at fern.org, at gmail.com. Have a good day. Thank you very much.